Glad to have you back. And like we told you, next stop now is on Lassa fever. Now, the viral hemorrhagic fever called Lassa fever has resurfaced in Nigeria, and we have reports now. Okay, giving you more at this time in Ebonyi State, where 4 people have died, including 2 medical doctors, and 139 people are on surveillance already.
Now, public and private schools in the state have been directed to stay shut as part of proactive measures to check the spread of the disease. Now, the resurgence of the disease has brought to the fore the need to scale up prevention mechanism to avoid an epidemic situation.
Now, how can Nigeria prevent another outbreak of this Lassa fever? That's the big question.
That's a big question.
It seems that we take 1 step forward and then 10 steps backwards.
But the point there is every year it looks like there's going to be one of these outbreaks here and there. The monkeypox was the new one that was added into the mix.
Yes.
Now we have joining us a medical doctor, Tui Mebawandu, joining us right now. Good morning.
Good morning. Thank you.
Nice to see you.
Nice to see you. Yes.
All right, Lassa fever. A lot of people, in fact, young children who are coming up, now, Lassa fever is a household name for them, even though they may not even know what causes it and all of that. But Lassa fever has come to stay. What is really the challenge that we can't put this behind us once and for all?
I think around August, we were here discussing this, the emergency resurgence of Lassa fever in Nigeria. And I said then that if we're not careful, we're going to come back and discuss Lassa fever.
Of course, I remember.
Now, here we are. We have a broken health system, okay? Secondly, we have an acute shortage of critical personnel that should be able to really make those changes in the health system. In addition, we're short of funds, because I was advocating what I would call the future preparedness for epidemics, a fund for future preparedness for epidemics. So we're short of funds, and we have a myriad of problems in Nigeria. We have challenges with education, with light, with fuel, we have with security, and here again, we're having health issues. Now, if you combine all these things, and then you see a critical population that have limitations in terms of nutrition, that have limitations, in terms of having able to escape poverty, that have limitations even in accessing critical health services. That's going to limit the spread of epidemics. So, all these things are staring us at the face. And when you mix everything, of course, it becomes very easy for epidemic then to come up again. Let's not forget that in Nigeria, Lassa fever is endemic. Let us not forget that there are cyclical epidemics that happen in Nigeria. Lassa fever is one, meningitis is one, cholera is one. So we see all this in the cycle. We can easily predict. Our predictive ability for this disease should have actually increased. That's why we're seeing them picking it quickly on a good note. But now the resources to respond appropriately and nip this thing in the bud and spot the epidemic before it starts, we cannot muster it. That is the big challenge.
In fact, it's a big challenge, and when you look at it, it's mind-boggling. For example, in Ebonyi State, we lost some doctors, and then other doctors had to protest, and they mentioned that the state doesn't have a functional virology center. Talk to us about how important that is to tackle an epidemic like this one.
Again, it's unfortunate that when this epidemic is going to announce itself, it goes to the tertiary institutions or medical institution and kill a doctor, a nurse, or a health worker. That is how it announces itself. That's why we then know that where the virus is around the corner again. So, but essentially, it's simmering. It's always been endemic in the local communities, in the society. People keep dying without knowing exactly what is the cause. Now, for any disease or epidemic, for us to really stem it, we need an appropriate laboratory and diagnostic skill. Okay? Now, for instance...
Like the one in Irua.
Like the one in Irua and Lut. The Abakaliki, the Federal Teaching Hospital in Abakaliki is, we had a new one, a new virology center. That Abakaliki is, we had a new one, a new virology center that's supposed to help in diagnosis, because at that point, when you see a case of fever that is not malaria, in addition, checking for Lassa fever will be, a normal thing. And then you have a center close to you where you can take it to. So the key thing is that early diagnosis. What the center is supposed to help is to really push forward the skill of early diagnosis so that we can then know how to respond appropriately. So that is what was missing, actually. That is what that center is supposed to do. But again, we've seen everything. Everything has been such that what you get is building, no equipment, maybe there are equipment, no human resources to drive the building. So that's exactly, what we see. That's the way we're seeing in the country. So that's why it's important that such a thing becomes necessary if we're going to really make a thing, with those things okay.
All right. Now, when it comes to the issue of this epidemic, it starts with the people themselves before you're even talking about detecting it here, detecting it there. What are the people doing wrongly or not doing rightly that even leads to an outbreak of this situation in the first place?
The starting point is education. Let's look at the people, okay? How far are we educating them, to be able to respond to those things at the local level? And we must be able to deploy a health literacy system at the local level.
But let me cut you short a little bit. When it comes to the issue of Lassa fever, where does it even start from?
From rats, rodents.
Okay, let's understand it from there first.
And then, the rat rodents, normally they're in the bush, but because we're doing a lot of farming, because we're also expanding our settlement, in a way they come in contact with our food, we come in contact with them, and they pass the virus to us in an attempt to feed, okay? And then that is the starting point. For us, when someone runs fever at the local level, when they're not aware of those kind of disease, that kind of disease is possible, they think it's malaria. They then do self-medication. By the time they get to the hospital,
they have similar symptoms.
Yeah, they have very similar symptoms. The key thing is the severe body ache, sore throat, and bleeding from some orifices of the body. That's the key difference in terms of Lassa fever. So what we need to do now, we know that the season is actually from around December to maybe March. We should start at that point to start educating our local people through critical campaign. What is the local government doing? What are they doing? If they cannot go to community and identify the high spark area where these things are likely going to rear its head.
National
and
orientation
then go
agents.
right ahead. It's not even national, it's local orientation. What's national? Go there, pull a billboard, put a billboard there, and say that, listen, we have entered the season of Lassa fever. Dispose your waste properly. Don't come in contact with rat. Wash your hand. If you have any suspicious illness, don't self-medicate. Go right to the hospital. Involve the spiritual leader, involve the traditional leader in such a way that all of them can be part and parcel of this campaign. So for us who lacking money, lacking human resources, and even having some degree of malnutrition and compromise of the health system of the general population, these are the kind of thing we need to start doing, because that is cheap, it's affordable, and it can have the necessary impact we think it should have. Okay. Now, that is at the primary level. But at the secondary level, of course, all the health institutions should be able to take universal basic precaution as a necessity. We must be able to not to really, guess, or try to act in a way that can compromise our health. That is because at every point you see those things rearing its heads among the health workers, what is happening essentially is that there's a critical breach in the universal precaution system. Okay? So it becomes important for us at that level to adhere strictly to that universal precautions in caring for patients so that we don't pick germs. And then, of course, at the tertiary level, the government should be able to do those responses in terms of diagnosis, adequate diagnosis, improve on the centers that you are going to use for diagnosis of these things, transportation and ensuring that the result comes back as soon as possible, provide drugs that can be used at the early stage, and also help in collecting data and even do some predictive thinking in terms of critically looking at how we can get what we call a system, early warning system, at this local level to know that we're going to get an epidemic. Okay. And if you look at the state of even some of our state capitals now, very dirty, very dirty. This dirt will promote the breeding of rats. These rats are prolific breeders. It will promote, the breeding of the rat. The rat will then, run around and interact with human more. And let us not forget, rat does not transmit Lassa fever alone. It transmits other terrible viral illnesses.
All right, now we understand that NCDC is now working with WHO again, so trying to solve this outbreak, prevent it from spreading even further. And this happens every time. Every time there is an epidemic, Nigeria runs to WHO, which begs the question: when can Nigeria stand alone on scientific research, carrying out enough research to bring, because we understand Lassa fever doesn't even have any vaccine, so you cannot even protect yourself, really. You can only treat it. Am I correct?
Yeah. You can't, there's no vaccine for Lassa fever. Now, in medicine, we collaborate. You can collaborate across culture because of the impact of an epidemic, on a community, on business, on health and finance. Okay? And the fact that the thing can also spread to other countries. So we collaborate, that's not out of place. But the collaboration must be structured in such a way that we are able to stand and have strength, sufficient strength, to be able to really deal with the critical issue. But as we are sitting here now, I'm sure the bill for the establishment of National Center for Disease Control in Nigeria, Nigeria Center for Disease Control, has not been passed. Okay? They are also, hamstrung in a way. And then secondly, the critical things investment that we need to make in the training of health workers to be able to stand alone, epidemiologists, virologists, laboratory scientists that can, again, look at these things, are absent. Look at the university system, perpetually closed. What quality of graduates are you going to, bring out from those things? Okay? Look at our secondary school system. No, but the STEM subjects, science, technology, engineering and maths are not being taught. They're not being encouraged. Where are you going to get people that you're going to take to university to go and learn all these things? So there are a lot of issues. And if we don't, we must appreciate the fact that, like John Ackers used to say, education is not just a social concern. It's an economic issue. It's a political issue. You want to turn your country around, you need to go and sit down and look at your education in such a way that we have to be able to create institutes and relevant agencies that can think, whether it's an NGO or anything, that can think and look at how to arrest some of this rot that is bedeviling Nigeria. So for us, as we are now, we have no choice than to collaborate. But it's not that Nigeria is not having sufficient people all over the world that can do a lot of things. But again, the push factor has taken them away from Nigeria, and, lack of infrastructure, no serious support, poor remuneration. These are the push factors that take them away and their family. They cannot even do research. Yeah. So until we now start addressing that.
And when they leave to all of these other countries, they do excellently well. Especially when they come from Nigeria. But we have to leave it here now. Dr. Tui Mebaondu, medical doctor, thank you so much for coming on the program this morning.
My pleasure, always.
I guess those who have the love for eating rats have to be cautious this period of time, I guess.
We need to take care of our waste. Okay. We need to do that, or else we'll pick another disease.
All right. Thank you so much. Thank you.